type of class. This Thursday, the lecture will cancel because I'll let you prepare for the lab meeting exam. 9:30 lab is okay. 12:30 to 3 lab, if I still talking, your mind is not there. I'm guarantee you're gonna look at your notes. So I'll just cancel the lecture. You fully prepare for the lab. I hope everybody to do very well. Okay? So that's a plan. So we're gonna teach a little bit more today. Then next week, I think we're only gonna teach on Tuesday because Thursday is a fall break. Then following that, I'm gonna put a review questions on the eCampus, so you can do it. And then the week right here, 12th is a review section, 14th is examination too. Okay, so that's a plan. So you have a little bit of relaxed schedule, but I'm guaranteed you may have some other exams going on. Okay, so we're gonna finish the human disease caused by bacteria. We're gonna talk about sexually transmitted disease today. Just to give 2 examples, not too much. So sexually transmitted disease. This is the one you should know. It's a severe problem in the whole country. This is about 300 million cases every year, globally. Okay? Now, sexual transmitted disease, of course, it's a sexual activity, causes infectious disease. And 95% of the time is from a male to female. This is from a survey. And we want to mention something. In sexual transmitted disease, there is no effective vaccine so far. And there are also no immune, or we say no strong immune memorization. So give you an example. If somebody has a syphilis, somebody has a gonorrhea, even if recovered, does not mean they will be automatically immune, that they're never going to have it. It's going to have it again. Because there's no strong immune memory. Last one. Lots of the case, about like 40 to 50% is asymptomatic. Okay, so that's the key here. Now, I want to mention something. There is a debate in the scientific area. Is this a social problem versus science problem? Okay, this will be, this is a question you can think about by yourself. We will have extra points, which is 30 points in the final exam, which is a thesis writing regarding sexually transmitted disease. Is this a social problem versus a scientific problem? And it is a prepared thesis questions, but you go ahead to prepare, and then examination time, you're going to write in the room. Okay, about 300 words. You're going to have to write it. So I'll give the detail later on when we close to the final exam. Because that gives yourself some education about sexually transmitted disease. So that's why we gonna talk about here, okay? We only gonna talk about 2 of them, gonorrhea, and later on we talk about syphilis. We're not gonna go everything. It's been lots of. So we're gonna talk about these one by one. First one we want to talk is Neisseria gonorrhea. Okay, G-O-N-R-H-O-E-A. So Neisseria gonorrhea, when you look at the picture, may not be very nice, but when you know this is a gonorrhea typical picture, which is urethral, urinary tract, you had a discharge, which is typically is a pus comes out, dead white blood cells. That's abnormal. So we're going to talk about that. So Neisseria gonorrhea, first of all, this is gram-negative. It's a cocktail. It's all a diplococcale and very typical coffee bean shape. look at the slides, it's very clear. You had a coffee bean-shaped gram-negative diprococcal surrounded by white blood cell. If you get some of the slides like that, it is typical Neisseria gonorrhea. Now, something you can do a review. Gram-negative diprococcal, coffee bean-shaped, is Neisseria gonorrhea. If gram-positive diprococcal, lancet-shaped, is Streptococcus pneumoniae. So you need to know there's a connection, but there's a difference. And this one, we already mentioned. If you remember, Neisseria meningitis, they are the same pathogen, same genus name, different species name. So just to remind yourself, it's very similar. It's a STD, no question about it. It is, so we call it, urethral discharge. So basically, it's a pus, comes up. Okay? Now, this Neisseria gonorrhea, I will be drawing here, which is a different diagnosis procedure for a male and a female. So this is diagnosis procedure. Diagnostic. So let's talk about if you have a gonorrhea for a male. For the male, the symptom usually is dysuria. So what is dysuria? Difficult to pee. In the lab, we will talk about UTI, urinary tract infection. We'll mention this again. Difficult to pee, dysuria. And there are urethral discharge, and very light abdominal pain, but not obviously like female. So once the male has those type of symptoms, what are we going to do? We will get the pus to conduct a gram stain. And the gram stain will show you the same thing here. Gram-negative diprococcal, coffee bean shape. Okay, then this type of person, we need to give antibiotics. Okay, and finally, we're going to do some confirmation testing. That is similar. How we do this? We using the pus, we do streak plating. Onto a special media is modified Sayer Martin medium. It is a special chocolate agar, or we say modified chocolate agar. Why we have to use this agar? Because it is a fastidious bacteria, same as Neisseria meningitis, if you still remember. Only grow on chocolate agar. And when on the chocolate agar, you will see it is kind of greenish, pushable colony. Remember, this is colony morphology. We barely mentioned, but this is the typical pushable colony. Another thing is that this agar we're using to grow the colony, we also could do an oxidase test, which is oxidase test positive. Okay, so we write here, this is oxidase test positive. So then you're going to ask me, what is oxidase? This is the one which is electron transfer in electron transport chain from cytochrome C to the oxygen, and they need this oxidase for some of the bacteria to let it happen. Usually, you use reagent, it is purple color. Okay, so that's oxidase test positive. This is for male. Okay, for female, what's the difference? if it's a female, your symptom a little bit different. Usually, abdominal pain with abnormal bleeding, which means on period of time bleeding. And you have some of a burning feeling might be. And also you could have some of other discharges, okay, from the vagina tract. Now there's a little bit difference. For female, we skip gram stain at the beginning. So we're not going to get the sample from female to do the gram stain at the beginning. The reason is, in the vagina tract, there is lots of gram-positive bacteria, typical lactobacillus, lactic acid bacteria. And they will be bothering the final identification. And for male, it's kind of simple. So that's why we skip gram stain at the beginning. We will be directly jump into right here. So when you have a sample from female, we will directly go to strict plating onto modified cyanotic media. And from modified cyanotic media, we are going to do three things. Number one, we go back to the gram stain. Number two, we find it is a pushable colony. And number three, we will do oxidase test possible. So I just want to show you something. It's a little bit of difference. Now overall, the Neisseria gonorrhea have another thing we want to mention is this is the one very sensitive to like a drying, like a so-called UV lights, and also to various antibiotics. Now, for female, there is another risk I want to mention. The Neisseria gonorrhea could also be transmitted from the pregnant woman to newborn baby. You have a picture right there. And the baby will show you crusts of the eye, like conjunctiveness, kind of like. Another one will cause this is chlamydia. Okay, so this is called neonatal gonorrhea. So also could be from pregnant woman to newborn. This is, we call it newborn gonorrhea. Okay. Oh, yeah, that's the procedure for the. That's something else I want to mention. And this newborn showing conjunctiveness, which is crust on the eye, around the eye. That's something for gonorrhea. This is we already mentioned. It's urethral discharge and beginning 7 to 21 days of infection. Okay, and it could be follow up something with the joints, pain, heart, and throat, but it's not really. Most of them still focusing on the lower body, on the urethral, or we say it's a urine tract. This is how we test it. Now you can do gram stain, oxidase test, and you have some DNA probe test, which is like a rapid test. Now antibiotic therapy, last one for the prevention. Same as other sexual transmitted disease, there's not really something you can do. And public education, condom use, quick diagnostic, all those things are the key. Okay, so this is for gonorrhea. The second one I want to mention is for syphilis. This is the one we talked about before, but we want to talk a little bit detail right here. Okay, regarding the syphilis, we mentioned our examination 1, lecture 2, when we talk about microscope. If you still remember, we talked about dark field microscope. At the time, we mentioned about syphilis already, so we're going to go back to talk about this. So first of all, syphilis is belonging to one special bacteria called Syphilis. So this is a very special bacteria. We regroup and talk about these special bacteria. These type of bacteria are very soft. Okay, it is asexual filament, kind of like so you can, because it's very soft, so you cannot using gram stem to diagnose them. Because when you do the stem, you do a heat fixing, it will be automatically, sometimes it will be soft, melted. So you cannot do a general dye. When you have an asexual filament, it is have an endoflagella, which is for the movement. So this is something we mentioned. We also want to mention where the spiral sheets comes from. This comes from cuts, bites, and abrasions. And for the spiral sheet, we want to also mention one thing. This is we use dark field microscope to do the identification. Okay, these are something very common for spiral sheets, and we already talked about. Now we want to talk about two things right here. The one called sexual transmitted disease is Treponema pallidum. This will be cause syphilis. Okay, so we're going to talk about syphilis. First of all, syphilis have different type. Same as gonorrhea. General syphilis, we call it a venereal syphilis, sexual transmitted. It also could cause the pregnant woman to newborn baby. We call it congenital syphilis. So we're going to talk about in the human being, which is adults. Okay, there are 3 stages for syphilis. Number 1, primary stage. Primary stage, it is typically about 3 weeks. Okay, what are the symptoms? The patient's penis will show you ulcer, or some of the red lesions there. This is gave a French name called chancre. This is the first stage. Second one, secondary stage. Secondary stage, it is 3 weeks to 8 weeks, or maybe like 3 months. What's going to happen? Okay, let's say this guy right here. Just drop away. If we draw a person here, this person will have a whole body rash. So this will be rash, whole body. What's the terminology for that? Right on your slide, it's called guma. It's also a French word. Now what happened here is, once you transfer from primary stage to secondary stage, this ulcer and the red lesion could disappear. Then become a whole body rash. So if the people that don't know, they seek some recovery, then they go to have a sexual activity, then cause small transmitted. Now you should know that most of the people who have a sexual transmitted disease as a sexual transmitter is not a morality problem because of the mental. Lots of them is a neurological problem. It's a hormone, the disorganization of the hormone or some of the neural problem. It's right on the brain, it's up. Okay, it's not lower. So when they see ulcer already lesion is gone, the shankle is gone, they move to the guma, they think it's already recovered. That's why they cause a problem. Now the third stage is tertiary stage. Tertiary stage, this is going to be 5 months to maybe 30 years or maybe the rest of their life. It's going to be very, very long. This is usually, originally, is going to be asymptomatic. Also could be become vascular disease, or it could be neurological symptoms. It really depends. Especially people asymptomatic go to the third stage and this disappears. Then they carry on. This spiral sheath trypanemia palladium, and they still have to continue to have sexually transmitted activity, cause more problem. This could be very, very long. Some people could be died, but some people could be still survive. That's, you can see, the very typical picture for syphilis. This is the #1 sexually transmitted disease long time ago in all the Asian countries, in all the China, Vietnam, and the south part of the Asian, all those places. It's a very typical place, and symptoms and no treatments, no effective treatments at all. So when you see here, how they do diagnose, dark field microscope to see the morphology, asexual filaments. And they, some of the rapid testing use DNA, use serological typing. They mentioned not really have a very good treatment. Early stage you do antibiotic therapy. More important, the public education, follow up like sexual hygiene and use of condoms. So that's the only way we can do. There is not many treatments if you go to that stage. Okay? So for sexual transmitted disease, I will be very simple to mention these two and left you topics to think about. The last one, same as spiral sheets, I want to mention another bacteria, which is Lyme disease. This is the one is important because some of you, especially in West Virginia, you like to go to the state park in the summertime, you do some of the fishing, some of the marine, like a lake or deep lake fishing or something. That could be caused Lyme disease, so we want to talk about that. So first of all, Lyme disease caused by the pathogen still belonging to spiral sheets is called Borrelia burgdorferi. Burgdorferi. Okay? This is the one. Why it's called a Lyme disease? This is in Lyme County, Connecticut. 1970s is the first time they find this disease. That's why it's called the Lyme disease. That's where the name comes from. Now, why it is called burgdorferi? This is a scientist name. Is a microbiologist at Montana State University. Back in 1970, do a lot of the research for Borrelia, and that's why we named Borrelia burgdorferi. It's a scientist name. Now, Lyme disease, what is a very typical symptoms? Is on the arm, you will see a very typical, like a target. So we say it's a target or bull-eye rash. It's a typical symptoms. And then you, of course, use fluorescence methods for testing this spiral sheets. You can use dark field microscope to see the morphology. Those are the methods we mentioned. This is the typical symptoms. At the beginning, in the Lyme County in Connecticut in the 1970s, they started to transfer in the New England area and go to Oregon and to California. So you can see the picture right there, what it looks like. More severe is on the top. In the New England area, West Virginia a little bit, not really. This area is a lot. Clean to the Atlantic Ocean, lots of people do. California, Oregon area, also a high risk. Middle, center, not really. If you don't touch the water, it's not going to be happening. So this disease, for the people who like to do the fishing, or like to do the deep ocean, or like deep lake or fishing, or diving, frequently in the summertime, they have to do an annual test, or at least 2 years test, to testing the Lyme disease, to do a screening test. Okay, now, this Lyme disease, where it comes from? This comes from ticks. Very strange and very interesting. This comes from ticks. It comes from a very